You two really were the leaders here. When you started this, how did you see the future? What did you see as really the future of mental health?
I think there was just a realization on both of our parts, actually, that there was a skill that essentially anybody could learn that could fundamentally change people's experience of life. And I think that it was very early in terms of science and in terms of popular culture as well. So we knew there was the potential there. We both experienced the benefits ourselves. And I think there was a sense of combined desire to get it out there and to demystify it and make it more accessible to people.
Rich, talk to me about the partnerships. How have those helped you find people that perhaps normally wouldn't be attracted to meditation or mental health?
Yeah, partners have been a huge part of the success of Headspace. Ever since 2010, the very first partnership we did with the Guardian newspaper, we launched, 1 million booklets on the front of every single newspaper back in, January 2012, actually. We've worked with the NBA, we worked with Nike, and more exciting, we've been working with medical associations as well as enterprises. You mentioned the Starbucks, Starbucks deal that as of January, 300,000 Starbucks partners are going to get access to Headspace, and for us that's like a really important milestone to, a huge company that is global in every single country around the world is now giving access to all of their partner employees is a big moment. And the AMA is another good one, another good example where with the official meditation partner for the American Medical Association. So every single doctor that is a member of AMA gets access to Headspace. So it's been a really important part of the success of the company.
And Andy, going forward, do you see more corporate partnerships the key to future growth?
I think it's one area of growth. I think we see it in sort of three parts. There's obviously the consumer, and there's B2B, and there's healthcare. I think already we're very fortunate. Most of our B2B has come. It's been inbound, and we've been servicing it, and so it's still a part of the business that we're growing at. I think the healthcare thing is what we're arguably kind of most excited about, both as Headspace and as our subsidiary, Headspace Health. I think there's enormous potential to get Headspace out to people who otherwise wouldn't have access to it or who wouldn't be able to afford it.
Well, Rich, when we talk about health, I think on Tuesday when you had Apple's announcement of the watch and incorporating more of health research into wearables, do you view that as competition or the more the merrier?
No, I think it's fantastic that all of the big technology platforms are building these operating systems. Our big belief is that consumers are going to have more information and be more educated about their health, and that's going to come from the data that these powerful devices are providing. And we really want to be sitting on top of all of those devices to be able to provide the interventions and the behaviour change that people need to actually change that data. So we definitely see that all of those partners are going to be absolutely fundamental to our success for our members. Without that, we don't think that we can deliver on our vision of improving health and happiness of the world. So we're very bullish on all of those folks building all these brilliant platforms for our members.
Andy, talk to me about the investor environment. When people come to you and want to throw cash over at Headspace, do they talk about where they want the future of the company? How has the fundraising environment been?
It's been really interesting. We're incredibly kind of fortunate, and so we bootstrapped for the first 5 years, and that I really think we learned a lot through doing that. And we've been fortunate in so much as that investment has always been very sort of forthcoming. I think right now there's a recognition that this area is absolutely huge, and I think it's moved from the recognition that the consumer space. There's a huge amount of potential to B2B and now healthcare as well. I think just within healthcare, right now, there's just not the ability to scale in the way that it needs to scale to service the amount of people who are struggling kind of with stress-related symptoms, whether they're physical or mental health-related symptoms. So I think the industry will only grow.